We're going to have interpretation for this presentation. At the bottom of your screen, you're going to see a globe that you can select, and you can choose the audio that you would like to listen to. So if you like to listen in English, just select English, and if you like to hear this presentation in Spanish, just select Spanish. Next. We also have the slides in English and Spanish on the top of your screen. There's an option that says View Options, and you can select the presentation that you like to see. This virtual webinar provided under the Health Resources and Services Administration, HRSA, also addresses health center governance, leadership, and management as a health centers work to become essential centers in emergency situations, and will provide information and discussion with participants on the role healthcare providers play in creating resilient healthcare facility systems. Next. This presentation has been also approved as an accredited provider of continuing nursing education by the American Nurses Accreditation Center. So you need to claim your credit, participants must submit the post-session evaluation. Next, we are just gonna talk about the conflict of interest. We have no relevant financial relationships that relate to this presentation, nor do we have any relevant financial relationship with ineligible companies whose products or services are related to pertinent therapeutic areas. Next. I'm going to introduce who is going to be today with us, Alma Galvan, that is the director that works with MCN. Alma studies psychology and also communication in healthcare. She has ample experience in capacitation and also with programs of healthcare providers and others. We also have Maricel Pagan Santana. The doctor serves as a senior program manager for Migrant Clinicians Networks and also with climate crisis. So in this function, she brings technical assistance, training of tools, or development of tools for the healthcare centers, and also to talk about different related issues that are as results of the different natural disasters. She works with the local government, and also she was part of the Junta de Gobierno de Puerto Rico. Thank you today for being with us. I'm going to pass it on to Alma first. Thank you, Alma, for being today with us. Good morning, everyone. Thank you for being here with us. And today we're going to talk about, we're going to have a discussion of the different ways of the risk factors, vulnerability, affect the capacity of the population to recover after a disaster. We're also going to talk about different ways of how the healthcare centers can contribute to patients, can help them before, after, and during these issues. We are also going to talk about the different models that we're going to talk about today to be essential have during and after the disasters, with a particular emphasis on the role that the physicians play. And with that, I'm going to pass it on to Dr. Maricel Pagan Santa. Thank you, Alma. Yes, if we can continue to the next slide. One thing that we're going to talk about today is we're going to focus about the emergencies, especially to the ones that are related to the climate change, within the healthcare institutions, these are not the only emergencies that can take place, and that there are others that are more related to infrastructure or human involvement. The climate crisis present the emergencies that are a little bit harder to prepare, or that we not have update any of the like climate variations that we are expecting right now, or what is happening within my community that didn't happen before. So we're going to focus on that aspect, because we know that this is not only damage the infrastructure of our workplaces, but also affect the communities that we offer services. Next slide. Within the discussion we have, this is a picture that we work with MCN, and you can go to our publications to find out more information. There's an article related to these topics. We work, or the way that we look at the climate crisis is to think about the environmental stressors, also to see the public policy and regulations that are around us, what things can make that the people or we as providers can have more barriers. So to see if there are going to be more adverse problems. So for example, we have flooding, dry, we have a lot of different deterioration of the air quality. Also, it's very curious that we are thinking like in October, like we think probably October, our problem will be like ice, and then we see that the winters nowadays are higher than we used to in previous years. With that, we see that there is more rain, or also there we are experiencing other climate changes that we are not used to. So when we talk about people that work outside, that work with the maintenance of infrastructure, with people that work in agriculture, like for example, nowadays they are used to have temperatures that are lower, more comfortable, and now you have a specific type of work that you perform, taking into consideration the temperature. But now we're still experiencing wave heat, extreme heat, and also these regulations that are in place or that doesn't exist or that are limited to work within when we're experiencing this type of emergencies. One thing that we see is that that combination of these environmental stressors, that public policy and regulations give us adverse results, such as migration, impact of well-being, illnesses and injuries that probably we don't associate with this type of weather, or we haven't seen it as with the percentages that we see now. And now we have deaths as well as a result. The next slide. So it's very important. I'm gonna go a little bit here where we have experienced this extremely heating during the summer in the United States, including Puerto Rico. We have seen this extreme heat very high, and this is the temperature that we see in the thermometer. That's not the real temperature. The dynamic between the temperature and the humidity, we feel that the temperature is higher because the dynamic between the humidity, this dynamic between the heat and the humidity is what is creating, or what we have seen is this extreme heat that we seen in Florida, for example, that in Puerto Rico, that are not used to see these high temperatures, like 128, for example. We have seen Arizona had a record of, it was higher than they have ever experienced. So now we are experiencing more extreme heat, and that is something that is threatening our health. And we have already documented that the extreme heat kills more people than flooding and hurricanes. So we're seeing this as something that it was not something that we have to worry about. It was an opportunity to go outside, to have different activities, but now this heat is a threat to our health. Next. Droughts. We have also seen how when we are experiencing lack of rain, we are having other issues like not enough access to water sources, and also there is a lot of system that we use to cool down places, and a lot of places need water. So if we don't have water when we experiencing droughts, we're not only going to experience lack of water, but also some products like we can see damage in the agricultural sector as well, because it all depends on how available is water. Or for example, we have these mechanisms of cooling, and when we have limited water because of droughts, we can see that we can have more complications to have places that have very safer temperatures. So these droughts come from also issues with our health as well. Next slide. Storms and intense hurricanes. Sadly, we thought that we were not going to experience this, or that we're almost out of this hurricane season. But then we saw what happened in Mexico with Otis, with this hurricane. Not only that they are more intense, but the time that the community have to prepare has decreased. So this is not the first hurricane that transformed radically from being a level or a storm to be a catastrophe. And not only in areas where we are used to seeing this, like for example, Puerto Rico, Florida, or in the Gulf, we are used to seeing these phenomena, but now we're seeing in areas where they usually didn't experience this type of natural disasters. And so we are going to see not only what we're going to do to prepare this population to be prepared before this type of event. Next slide. We have flooding. We have seen them in several regions in the United States that are not typical, in places that that we're used to seeing them, like rural areas. But as well as places that are close to rivers or lakes that are causing these issues. But now we have flooding in urban areas that also make it more harder for the health providers to provide their services, or emergency services to provide their services. So in Puerto Rico, we have like severe flooding in urban areas caused by a combination of extreme. We had a period where we experienced a lot of rain, like a very long rainy season, and this caused very severe damages to cars, infrastructure. And this type of situation is what we're going to start seeing. A lot of the rivers or the way that we are preparing for these type of situations are not ready. So when we see more flooding, that probably we saw something as normal when we experience rain, like for 5 hours, for example, is not extreme, but now they are a problem, a really big problem for the different communities. Next. Air quality. Not only because of the type of contamination that we're experiencing, but the temperature plus the contamination in urban areas, we're going to see that relationship playing a little bit more, that there are a lot of chemicals that are not going to be able to move because of the higher temperatures, or are going to be more concentrated. So when we're experiencing extreme temperatures, we're going to see that the quality of air, we're going to see how if there are areas where there are more chemicals, we're going to see that the deterioration of the air quality. For example, we have seen the Sahara desert levels, for example, they also will experience kind of a similar process. So we're going to experience that the quality of air is going to be affected by these high temperatures and also by fires. And the fires are also related to the climate change. So we saw these fires in Canada, for example, that affected all the east section of the United States, New York, including Maryland. So we saw that these communities that were not used to experiencing that bad air quality caused by fire or by an event such as this one, now they have to think how to protect their face, use masks or some other things to protect their air quality. Within this, we need to consider that not everybody is going to be affected the same way. I mentioned earlier that the people that are working outside are usually the group of people that is going to be affected directly by these events because they are outside, they are exposed, especially people in construction. We know that the places that have been impacted, there are a lot of construction in their regions. So all these people that is working outside and the people that were used to work outside, like the people in agriculture section, they are going to be affected even more. There is also other factors like low socioeconomic level, like children, pregnant women, patients that have chronic diseases, for example, not only because their bodies don't have enough it's like, for example, if they're experiencing heat or they don't have electricity, if patients cannot have access to medicine or cannot go to a treatment center, their treatments are going to be affected because the service or the equipment probably cannot turn on because there is not electricity, for example. Also, another reason is because if patients are exposed, and I want to raise the flag, like the patients, because of the medicine, they are more vulnerable to extreme heat conditions. And there are other patients that have more emotional issues or, for example, diabetes, where higher temperatures can cause them an episode or can cause problems to their health. So we need to take that into consideration. And also the immigrants as well, that is part of the population that we serve directly. We know that they are more vulnerable. Next slide. Another of the events I was mentioning, and I was talking about events where we have waterfall type of events. For example, we have an event that is a hurricane, and then we have another event that has a generalized problem. Like, for example, we have the first emergency, and then the secondary emergency will be like no electricity. For example, we have an example when we have a Hurricane Iota that it did landfall in Nicaragua as a category 4, and not only cause problems and when it comes to the supply chain of food, but also a lot of the vulnerable population have to be moved from their own location. And one of the things that you can see that an event that occurs in one region is not disconnected to how this can impact other regions. For example, a new population arrived to another region trying to find some sort of service because there is lack of main resources in their current location. Maybe there is political instability, so there is not essential services, and the government cannot deal with this situation, and now they have to be displaced, so they have to go to another region. And so we have a population that have been displaced because of weather-related issues, and then we're offering services to this other population as well. Next slide. Here is a continuation. For example, in Guatemala, we saw a loss of our crops, and that generated malnutrition, not enough food, and that forced the people to move. And that happened 2010 to 2022, and this is going to be more important when Alma talks about her section, because a lot of the resources that we have available are going to be adapted, so we are going to be able to share the linguistic, cultural, educative necessities that are going to need when they arrive at our area of service. Within the vulnerabilities, we're going to, when we see the first slide, we're going to see talking about regulations. We're talking about, when we talk about vulnerabilities, we're going to talk about the population that is more at risk. So what is the vulnerability? So we have these differences, cultural and language differences, then like a low income and they cannot manage this type of disaster. This happens, for example, in areas that have low income, that they don't have everything necessary to be prepared. So at the beginning, they are already trying very hard to see how they are going to survive, and then they're asking themselves, where do I get the money to be able to prepare for something like this? So they are more vulnerable. Also, we have inherent dangers and risks of occupation with people that works outside. Also, we talk about migratory status, because they can experience discrimination. They can be scared they are scared of asking for access or resources. So this is going to impact their lifestyle, right? Have access to services. Also, if they can lose quality of care if they move from one place to another, if they find healthcare services. Also, lack of access to health care, and also the financial resources, as well as the lack of regulatory protection. Not only that, they are working outside, but they are immigrants, so they can see that their rights are being affected, not only because they are scared of report what is happening, also because there are not these regulations nowadays that can protect them as well. Next slide. The access to healthcare also is being affected, because the language that is being provided is not the same language that the people speak. Also, the transportation is another barrier. Also, healthcare insurance, also mentioned that they have fear. Also, these services and these centers usually work during working hours, and there is that they have to make that decision between getting paid or get healthcare. So they have to decide whether they have to get the medicine that is active and not reactive. We also saw during they will not have internet and will not have access to have those services with telemedicine, for example, and as well as they will not be able to transport themselves from one place to another, and then they cannot have discontinued health services while they are moving.
Some of the additional barriers is this disparity between the response. I mean, there's some instances that the emergency signals is not in a language that everyone can understand. So there's not a second channel that we can work with people that speak other language. In the case of California, this happened over one of the forest fires. One of the main channels that was used to send the information about evacuating was did in in English. So a lot of the Spanish-speaking population didn't have the precise updated information, causing an evacuation problem and knowing which were the steps that they had to follow. So the response and planification, it's a little more urgent towards areas with a better economical status, and the more rural, lower income areas do not have the infrastructure to maintain the basic services. Another thing is the communication. We saw it with Katrina, Hurricane Maria in Puerto Rico. The um, recovery processes are not equitable, and some of the population doesn't even uh, receive the help, including health, but also housing. And as I mentioned before, there's an impact to mental health. It's very harsh on older people's mental health, especially on the farming industry, and also an economic impact. But people are impacted by heat, uh, the heat. And because of the exposure to the heat, someone in Florida died on the field. And because of global warming, we have seen the effects. And OSHA is making an investigation in 2023 about this. It's situations that we've seen, um, and this is other than a direct impact that's like on the hurricanes. With this, I'm gonna pass to Alma instead of like just looking at the downside of everything. Alma's gonna talk to us a little bit about the alternatives to help these communities and prepare the recovery phase of it. I'm gonna speak a little bit. If we can go to the next one. There are a few strategies. I'm gonna speak a little bit about cultural adaptation and resources and services delivery, but I'm gonna refer specifically about a public health strategy that it's called commu community mobilization. And I'm gonna assume that most of you work with local health centers and how you can utilize this strategy. Go to the next one. Next. This strategy of public health is very used in different Central America and South America countries that has been worked out through this strategy with malaria and other illnesses. And we're trying to implant it in Puerto Rico and other U.S. territories um, to work with these natural disasters that are driven by the global warming. So for us, it's a climate crisis. So this strategy is the spine of so we can promote the sustainable development that we're looking for in 2030. So everyone in this world have the right to access to health. It's not only a state obligation, but also the community has a really important part in this. Go to the next one. And when I'm talking about community, I include the social and economic factors. So in the social and community mobilization, um, there are practices that should be positive but also sustainable, so we can use them over time. The fundamental part is that people are the ones participating, promoting, developing, and realizing in these um, preventive measures, and make sure that this is not imposed by other organizations. In this sense, the community mobilization is not telling people what they need, but asking people what they need. It's not telling people what they um, what to do. Is involving people in figuring out what needs to be done. Is helping people organize so we can solve the problem. And it's also not preparing a plan for the community, telling them you have to do ABC. Is actually supporting the community and planning what they need to do. Next one. So this public health strategy has three factors or elements very important. Uh, the social communication, the social mobilization, and so these three focus or factors are very participative and are developed through the work with the people, and is delivered to the groups and the community so they make the changes. So they work with the issues that they think are important. So we need to make sure what it's important for them. If you go to the next one. Within this focus, there's a few elements very important. This is the theory, so you can figure out how to use this in your health centers. You need to make an analysis of the situation. And as you know, situational analysis is made in some of the programs that you already work with. So this shouldn't be very difficult. So the next is the identifying and mapping the key actors. The third element is the social communication. That has to be very clear, very wide, and very effective, but very localized. That's very important. It has to be adequate to the community. And of course, after all this, it has to be there has to be a strategic planification. This is not in priority order, like we should do this as needed. Of course, the analysis and the uh, app mapping and identification of the institutions that will be working on this, these do need to be done before the planning, the strategic planning. And the interpreter can tell me if I'm going too fast. So we saw the most important elements. Now we're gonna see the steps, the key steps. Situation analysis, mapping of actors, but also the resources available. And don't worry, if we're going too fast, we're gonna have this presentation available for you afterwards. And even if you have any questions or you need any help or you have other ideas, you can send us an email and we can assist y'all with anything you need. So repeating situational analysis, the mapping, and the social communication. The social communication is very important because we have to let people know what we're doing. If we're doing a survey, if we're asking people questions, we have to tell people why and what it's for. so people are comfortable answering the questions, so they feel part of the process. And within all this, we have to strategically plan for the moment that so that when a disaster occurs, we have a plan before, during, and after the disaster. We we don't only need to plan the our reaction and our actions plan, but also a communications plan. Um, it's very important to let people know who they need to contact, where to go, and the most important thing about this is that we have to implement this within the community, but not at the end of the process, but during the whole process. Go to the next one. Marisela was talking about the inequities and how who is the climate crisis affecting. This strategy, this public health strategy, tends to these social barriers that are being generated because the community knows who's who in the community. The health centers and y'all that work in these centers know the community. Um, you know the people that have diabetes, the people that have hypertension, and these people you're gonna get to know better so you can serve them better. So the health concept is not only about someone being ill, but you need to make sure that people feel better all in all. So this is where all these factors come in. So we're also going to identify the barriers and the impact of the mobilization community, the community in mobilization. And we're going to do it um, in a culturally correct manner, but also in a very localized manner. Um, so we can do it in one colony or in a suburb or whichever the community is. And also in one of the boroughs in Austin. Next. So you might be thinking, why are you so interested in us using this community mobilization? Well, this strategy has been very effective at identifying community leaders and connects the health center to the community leaders. So this also gives the health center a lot of credibility and also ensures that there's trust from the community. So this way we can we can make shared decisions. So it doesn't fall everything on the health center. It's a shared decision. So it's a very important part that each health center has a plan to prepare for disasters. And if for this plan for disasters where the community is included, and if you include this strategy in that community part that we include them, so there's going to be a community involvement very important, but also complying with all the HRSA ruling. And the good thing about this is that this is not only ample, but also local. And the same factors that are using any community, you can identify the factors and document them. And another very important thing about this is the evaluation, the participation evaluation. It's key to for the community to say, this is working, this can be bettered, we can use this in any other way, this is not working. And that's the important part of giving participation to the community. So they can say, this is true, this is not true, and this is what we need to change or keep.
Yes. So here we have some of the techniques that are effective and that are successful. So we have the analysis of the situation that I'm going to talk about, as well as the surveys of knowledge, attitudes, and practices and risk perceptions of the communities. Because many times when we're working with the community, we have a demographic study and we don't update it. Some medical centers, they have to do this evaluation to collect what is happening, to get this information. And this information is not going to just be saved on a file link cabinet. This should be used to be generating projects with the community between the health centers and the community. So this is something that we should be capitalizing for the health centers that are already doing it. Also, there are some studies that are for rapid needs assessments. There's also focus group, key informants, in-depth interviews and observations, resource mapping that we have talked about, local and community actors, existing and territorial capacities. For example, we have people that focus on home visits that have to do with diabetes, for example. Next slide. These are tools that can be implemented or deployed during the field work. So we have the workers, the community workers know about these tools. And when we get together with the different authorities, with the leadership of the healthcare sector, the people that are in the committees, we have to get together that even though they don't have like a formal or official job, sometimes they are the ones that are providing the information. Also, it's very important to have meetings with the community, meetings where you can coordinate, training workshops, as well community forums. That is a very good technique when you get together with the people and tell them what's happening. And through this technique, you can be planning, validating, improving the plans that you are working hand in hand with the community, the healthcare centers, as well as it's important to have follow-up meetings, also to have a disaster preparedness rehearsals, also document all the activities, and also create analysis of the emergency plan. And once we have identified what message we need to send to the community, is who is going to approve it, and the community is the best one that can say, yes, we understand this, we don't understand this. So that is very important. And again, the participatory evaluation is very important. Next slide. And also, I'm going to talk about 3 of them very fast, because I know that you already do this type of work, so I am not going to just give you information that you already know. So this analysis, situational analysis, so the purpose of this is to create a consciousness, a comprehensive awareness of the actual situation, as well as visualize what are the weaknesses and areas, and also what are the strengths, and can be done for the community health centers and also the community, and then we can get together and compare them. And the objective is to plan activities that are appropriate for the internal characteristics for that community, for what is happening with that community. Next slide. And it's very easy, very so we have S as the strengths. So those are the internal conditions that are strong within the health center, I'm gonna think about the health center, and I'm gonna see that the people are well trained, for example, and are those conditions and circumstances that are within the center, internal. So if we with this analysis, we're gonna see what are the strengths of this community. So then we have we have the opportunities about the external circumstances that we can take advantage and do something. And then I'm gonna go to the weaknesses, limitations that are stopping that something continue. Maybe people don't trust in the health center. Maybe people don't go because they are scared to the health center. Or maybe the people rotate a lot with the people that do outreach into the community. Maybe that's a weakness, no? Or maybe we don't have enough money to have interpreters if we are talking to a community that only speaks Spanish, for example, and we're in the United States. And the last one is the threats that are the old negative aspects or harmful aspects that are a barrier that is stopping us for implementing this work plan. Next slide. So here we can see a few of the examples when we're talking about a community health center. So what are the strengths and the weaknesses? For example, the weaknesses, like people have to wait a long time. A strength would be like people, the team is multidisciplinary, have a lot of knowledge, it has a good organization, but they, for example, don't have a disaster plan updated, for example, or they have a plan, but nobody knows what is this about. Also, maybe they don't have enough workers that stay for long periods of times. Then we can see the external factors, so the opportunities. So the hospital is in an accessible place, is located in an area that is very strategic, and maybe this hospital has very good relationships with other institutions and with leadership, members of the community. And the threats is like, for example, there are patients that are abandoned, then there is a lot of natural disasters, and they are not being organized or what they are going to do during these natural disasters because there is not enough people, for example, or we have a low budget. Next slide. So that is what is this analysis, and this is the format that we work on before a disaster, during a disaster, and after a disaster. Next slide. I'm not going to stop there. And then what I'm going to speak about this needs assessment. As healthcare centers, we know in theory what people need when it comes to healthcare. But remember, healthcare is something that should be more like complete, and people can have different needs that one way or another are related to health. And then we want to see like how much knowledge people have about this. So, for example, people know about natural disasters. What kind of information they have? Are they ready for a flood, for a hurricane, for a fire, and what they think and how they are prepared? For example, next slide. And this can be a process that can take long time, but we also have techniques that are short, like this one we have here, rapid needs assessment, that is short, simple, and most of all is fast. And why is fast? For example, we have a community where LGBT, for example, young people, elder people, and immigrants. Then we have a community with Haitians, and then that only speak Creole. So we can go to these different communities and choose one person that is the key person for this community, and then have a list of questions, and then ask them what do they need, what each community need. Let's collect information, what is important for them, what is important for us in the shortest time possible. And the most important thing about this rapid needs assessment is that you can have opinions from everybody, that you don't exclude anybody. And for that, it's very important to go to different areas of the community. Maybe we cannot agree with all of them, like in politics, but we need to work together, because when there is a natural disaster, the natural disaster doesn't see if this is for this party, this is for this other party. When it arrives, it affects everybody, or it's not gonna see if we're going to agree with the same opinions. It will affect everybody the same. So the very important thing is the key is to have the opinions of all the members of the community that are key members of the community. Next slide. And when it comes, we have the health promoters, for example, or the people that are doing outreach with the community. In theory, they should be part of the community, so we can generate a greater effect, or be more knowledgeable about the community. And I'm going to finish with this other survey CAP, that means knowledge, attitudes, and practices. These type of surveys are used and can be done very fast as well to determine what is the knowledge that the people have, the community have, how they react when there is natural disasters, what type of values people have, how people react. If you know how people are going to react, respond, you're going to know if that practices or that attitude and that knowledge is going to help you or not. So then you're going to know what you need to work on that community. And what you see on the right side is the type of forms that you can perform these surveys. Like, can be face-to-face with the head of household, and then it can give you a lot of different data, like demographic characteristics, housing condition, immigration, and etc. These are very useful type of survey. So here, for example, you can see some of the formatting or how we can use the information. I'm not going to stop here. We can go to the next slide. And here in the last one is the resource mapping. That is a technique or a tool when we can identify all the actors, internal, external actors that are seen or not seen, the abilities, the knowledge, the places that we can use within a geographical area to work. Next slide, please. So here is another format of how we work on the resource mapping resources. And here is the process that you can use. First, you have a list of all the resources, and you classify the resources, and then you can see how you can make a combination or create a relationship between them. And here we have other techniques. We have key informants, as when you talk to a person that is part of the leadership agent of change in the community. If you work with these people, it will be easier to work with the community this way when we have the meeting groups and the community circles. So people just get together, and then we can take advantage of these groups that already work together. Go ahead, Marta.
So I want to finish making a comment that the community mobilization has a great impact. If you use it as a tool, it has an impact on how we do things. It's going to be more effective. You're gonna spend less money clinically. You're gonna give more participation to the people in the community, just like Maricel said. The diabetes patients, the people that have mobility problems over a crisis or an event. So this way we can know what to do before, during, and after an event. And uh, in terms of programming, it also impacts uh, the clinic, but also um, your results numbers will be impacted positively too, but also giving the community uh, uh, the capacity to participate on decisions, and they're going to feel like they have the capacity to participate in solving their problems. But for the most important thing is that we're going to be more healthy all in all. Go to the next one. And Maricel, I would like if you can talk a little bit about these um, examples about the mobility community community mobilization. Yeah, we've been able to have collaboration with some of these examples. Others, we've heard about them in the California case after the situation with the um, forest fires. Um, there was a response from farm workers care. They worked um, with the capacity of those farmers to make their response program more robust. And these people um, receive the new workers and redirect them to the shelters and assist them with the recovery process, like asking for government help. In the case of Puerto Rico, it was a project that MCN put together with some of the centers in Puerto Rico and to develop recovery plans that were integrated with the health centers in Puerto Rico. Um, this was coordinated with the health centers in Puerto Rico, and we saw the benefit not only in the communication with the community, but the way the center uh, changed their services. After you get to know the community, you realize that some of the services that you thought it was going to be more effective or successful, you find out that that might not be the case. We saw some centers adding dental clinics and mental health clinics. In the US, we also work with National Alliance of Farmers to promote immunizations against COVID-19, but also tend to the lack of information in the Hispanic community. This had an impact with the farming workers too. So these are good examples of connecting the processes of providing uh, health services with the community. And I want to talk a little bit about this last example of Dominican Republic. The uh, mobilization, community mobilization strategy was implemented as a systematic strategy within the whole national public health process. So their public health department and the promoting agency, they stated that this is a tool that they that is immensely needed and how they can use it with malaria and any other problems, um, especially on disaster prevention. And I think with this, Maricela and I, we finish. There's other other things that we can apply this with. So we wanted to thank you for all being here. So the next two slides are pretty much the resources that we have for the community. Um, and the resources for heat management and also a curriculum to work with schools and pairing the health center with the schools, so making them together um, a great resource to talk about these problems. So Martha, we continue with you. I just want to remind everyone to submit the evaluation for this training. I'm gonna send out a link for the survey in English and Spanish, but also the presentation in English and Spanish. We're sorry that we didn't have time for questions, but you can send your questions via email and I can forward them to Alma or the doctor. And with that, thank you for being with us. Thanks, Alma. Thanks to doctor and our interpreters. And later today, I will send you an email with all this information. Thank you. Have a great day.